very good morning to you all. And I would first thank my team who put this together, did a lot of hard work. And I'll speak only for a short while, but give you a sense of how this got started. See, I'm in healthcare by default, not by design. There was no way I could have been in health. And my mother was a class 1 government servant. She was serving in BHU, and she was a PhD in nuclear chemistry. This also brings to the fact that highly educated people also get down under health. And my father was serving Lucknow University. He was a topper in chemistry and a PhD in chemistry too. So I come from a family of academicians. And when you are born in a family like that, the only thing they want is become a teacher or a bureaucrat. There is no third goal. Private sector is a clear no. It is not at all in the horizon. So one fine day, the doctor called me and he said, Rajan, what's your source of income? And I still remember, I'll not shy to name him, is Dr. Hari Shukla, he was head of oncology in BHU. The Dr. Shukla, it's her salary. She's not going to last more than 6 months. She has T4 stage cancer. So as a student, I was not a good student. I was a very good student. I was a university topper, but I dropped out of studies. So what health did to me is drop out and get to search a job. And I landed in healthcare. So I say healthcare by default, not by design. That was first thing, in a family, we had patients of everything from cancer to cardiac failure to epilepsy to MDR, everything. So on that qualification, I qualified to be in health. And I have passed through all the things that one passes through, on the other side of health. And I also had a chance to work with the health minister as an advisor for 3 years. And I wrote many policies, but 2 policies which are very close to me, which I think I would always thank the Almighty and friends for, is the National Health Policy and the National Education Policy. But the learning I had from that is the genesis of this. Of course, this was ideated much earlier. In my 3 years of 2016 to 18 as advisor to Union Health Minister, I have not met, I would say, a single patient representative giving inputs. Not at all. Only mails I would get is, sir, we are passing, because when they write to the Union Minister on his email ID, they CC his advisor also. Sir, we are passing through this problem. Can you help us? But no one ever came and no one was ever, reached out for inputs. So I felt that in the entire ecosystem where in healthcare we are supposed to serve them, where is patient in this discourse? And that's probably why healthcare is not changing. And this was ideated in my first book, which I think you cannot change certain things. In 2014, when I wrote my first book, I wrote that, in the inner back cover, it was written, I'm in the process of setting the patients union, which is exactly this. But then I got into the government, years flew by. And then I told my team last December, 6th April we'll launch. And they say, why a weekday and why 6th April? I said, 7th April is a World Health Day. Shouldn't we have something for the patients a day before that? At least it'll bring focus to that. And let's do something, because when you set up, when you come with such values in a family, you are taught to do things which are about society. So even when I set up this organization, which is, I think, 7th or 8th organization I have set up, I said, we'll be an organization for purpose. We'll be an organization for transformation. And if we also didn't do this patient union, we will be like any other healthcare organization out there to make money, and that's not our purpose. So everything we do at Digital Health Estates or any of its constituents, and most of you have been a part of, we are all driven by saying, are we driving a change at the grassroots? Are we impacting that? And this is exactly what we have tried to do through this patients union. When we spoke to a lot of friends, I WhatsApp Dr. Tedros, Dr. P.M. Namgyal is representative, and our director of WHO is here. We have many people. And I said, if we don't do things for patient, if we don't get them to be voices which we need to hear, we have done disservice to health. So that was the genesis and why we're holding on weekday. People told me, if you get it on a weekend, you'll get more people. I said, no, 6th April is fixed. In fact, our goal is that at one time we should celebrate 6th April as Patients' Day. That should be, because there's nothing for patients. And people have asked us, a great idea, why didn't people don't do this ever? I said, not our problem. We are supposed to do it, and that's why we are doing it. And I think we are out here. We are thankful to the Ministry of Ayush, in fact, Ministry of Consumer Affairs, a lot of our friends in the Ministry of Health, people like you all here, and to say that did the work, it's a great thing. I said, no, it's just the beginning. In fact, today is Hanuman Jayanti. Greetings to you. And that also is very coincidental. He uplifted the entire Parvat to cure someone. We have to do more heavy lifting than him. We have to lift the entire patient community, bring them in the main discourse of health, and try to bring a bottom-up change through that. I think this is the first time where patients will be on a platform. This is an app that will be launching today, and it will iterate as we go forward. But this is where we will try to get patients talking about what they need among themselves, trying to better their healthcare, also talking to policymakers and the industry of what exactly they need. I don't think that after this, we will be able to ignore them for long. It's a start, it's a beginning. I think in a year's time, we'll be the largest platform in the world for patients by them. We'll be driven by them. It's a clear thing we have taken, like any of the things that we do. We are not driven by any corporate interest. Neither will let them ride over our goal. So this is what we call as real work. These are the real patients. And that's where we say we'll do the real transformation. With this, I welcome you all, and I am sure that you will have a great day ahead. This is the first time where you will have patients on the dais. You'll be hearing patients. You will not be hearing others. Those who even speak from the provider side are the people, we have very carefully picked up people whose heart is in the right place, whether it's a professor from AIIMS or the person representing a patient family. These are the people who will tell you what they feel should change in healthcare. It will be a shame if we didn't act on it and not change it. The first step starts today. With this, I welcome you all and have a great day ahead. Thank you.